Here at Partnership to End Addiction, our mission is to end the addiction crisis in this country. This is an issue that's affecting so many families and every community across all four corners of our country. The focus of our work is in understanding that addiction is a complex disease. It's a preventable, treatable disease, but it's one that has roots in adolescence. And one of the things we've learned from our work through the years is that when families are involved, outcomes are better.
I originally found Partnership about 7 years ago. My children were struggling with substance use, and I felt very alone. I didn't know where to look for answers. I was, in a really dark area of my life. When I first found Partnership, I found out I wasn't alone, that there were so many other families just like mine, also looking for answers and there to support each other.
Our strength, the thing that we bring every single day is the research-based, the evidence-based information, resources, tools, and skills. The more we can share that information, the more young people we're going to reach and ultimately impact.
Our logo is a heart and a check mark, and it symbolizes the need to marry compassion and science to help people get better.
We've come to understand that there's really three imperatives, three keys to ending the addiction crisis in this country. The first one is making sure that we're doing all we can to prevent and delay substance use among young people for as long as possible. The second one is doing all we can to ensure that every young person who needs treatment is getting quality treatment. And the third one is equipping families, parents, caring adults with the tools and resources they need to effectively support their child and loved one.
The focus on family involvement is essential. What we know for individuals who suffer from the disease of addiction is that they are significantly more likely to recover and begin to lead a life in recovery if their family is directly involved.
Our free services are bilingual in Spanish and English. It includes a helpline that's staffed by trained clinicians, our peer support program, and also automated programs where people can get instant updates and information that they need that's tailored to their family situation. We supply free educational resources and tools to our families through our website, and thanks to our amazing partnership with Google and Meta, we reach millions of families every year through social media, through our podcast, and through our videos on YouTube.
It's a complex, multifaceted disease.
When I learned the Partnership program, I, started learning to take care of myself again, and that just really changed things for me. It really helped me to form new ways to communicate with my kids and new ways to just have basic conversations. And then I reached out, I filled out a form online to train to become a parent coach. 2 years ago, I switched roles and began working at Partnership.
It's so wonderful having Kathy here because she is such a powerful advocate, making sure that we are talking to families in the voice that matters to them and supporting them in the ways that they need. There's nothing that compares to a parent who has been through what she's been through, giving back the way that she is.
For me, that program changed so many things for my family, and that's why I do what I do today, because I want to help other families and pay it forward.
We understand that ending the addiction crisis in this country ultimately depends on our ability to work with as many partners as we possibly can. That certainly includes parents and families who we work with directly, but also professionals all across the country who are working with young people every single day.
School professionals, mental health counselors, even governments, all of them play a role. We offer trainings, we offer consulting and professional services, and we build tools so we can use technology to help professionals improve outcomes and make their lives better.
Clinicians out in the field are fighting on the front lines, and they often do not have the time or the access to academic papers. And so the partnership fills that gap. It allows clinicians to go to one source where they can say, this has been vetted, this is what I know works, I can pull it off the shelf, and I can use it with my patients tomorrow.
We also partner with local organizations that are serving their community, like the Hope Movement in Arkansas, Andrea's House in Maryland, and Family Connections in New Jersey, all of whom are using our resources and our knowledge and putting that into place so they can improve the lives of the people around them.
This is a constantly changing disease, and professionals need to have access to people who are researching, understanding that, and equipping them with the latest information and knowledge.
One of the powerful things about our approach is that we're having impact on multiple levels. We have the research, we have the direct services, but together we're using that in a voice that really affects systemic change, right? Catalyzes the kind of impact that we want to have in the form of smarter policies. And that's what's going to allow us to ultimately transform the way the country is addressing addiction. And when we do that, there's going to be more young people across the country who are living healthy, addiction-free lives and doing all they can to achieve their dreams.
Partnership to End Addiction is dedicated to doing all we can to bring an end to this heartbreaking crisis that affects so many lives. Prevention, treatment, and parent engagement are the three cornerstones to solving this crisis. Our dedicated staff at the partnership are implementing practical, science-based solutions, equipping people and communities across the nation with the tools and the resources needed to help the young people in their lives. As the board chair, I thank you for your generous support of the partnership's mission to end addiction in our country. With your support, we can deepen our reach, leading to more lives saved and bringing us closer to ending this crisis.